Now so they look at everything we concern well body, we watch the physical, the mental, emotional, and the spiritual side. But before we go before the program, we could watch what the God word say inside Isaiah 30 verse 22. It say, "Ye shall defile also the covering of thy graven images of silver, and the ornament of thy molten images of gold. Thou shalt cast them away as a menstrual cloth. Thou shalt say unto it, Get thee hence." Okay, so for them, we want to push the program go before. Of course, as you know, we don't start with woman series, and last week we watch menstruation. So we get wonderful guest Lala become talk something about menstruation. This is something we not so common, not like a common topic for discuss so broadly and openly, but now a topic we need for to discuss, especially for young people them out there, especially first timers and all. So we want to continue with this particular topic, yeah, so menstrual hygiene, menstrual health and hygiene. And today we wonderful, a very vibrant, wonderful sister with we here, Dr. Davida Sesay, a house officer, and you can go ahead and introduce yourself.
Yes, so family on a push on a cabo. Me a Dr. Davida Sesay, and in a house officer currently in a Princess Christiana Maternity Hospital, we can call Cottage, and I'm glad for the part of this program.
Oh, we are happy to have you. So don't forget to say you can join we add voice to the program on the number 079 716 255. 079 716 255. You can call or text, or you can drop a comment down below on we Facebook and we YouTube page, Faith and Bible Church Headquarters. You can on Redeemer television. You can drop your comment there, and then we we go see you comment and then go respond. So we want to go before with the program. We want to get a clear understanding of this menstruation, how it can happen, what it can cause for make a woman go through menstruation and not a man. Okay.
Well, I believe from the beginning of time, waiting God made what a woman for, for carry, a seed for being more of a multiply,
Yeah.
So definitely not to the man.
Okay. Okay.
So the woman gets a womb.
Okay.
So I mean, some Bible scholars they can say what make them call woman, and because a man with a womb.
Okay.
Right? So they carry, a baby. So the reason why I make menstruation they can call, and because of what we call maturity or puberty. So in that case, every woman they go through that cycle. Every woman gets a time where everybody they look and say, this woman now. When you see woman mature, what thing they look for next? Blood don't begin come up by you. And then they show say this is capable for get speaking, capable for get belly. When mean say this woman they don't turn woman. When you can there's so picking an entity there, they don't turn by it so you turn woman in day where you begin for see menstrual period. Because at that point in time, you don't mature, you don't for carry another human being, right? So menstruation are all, the process we surround menstruation are all about maturity, puberty. So women they go through that particular period, they for sure say they are capable enough, they are well enough to carry another human being. So menstruation, now where at the end of every month, women they see blood they come out. And that blood they get special processes where they occur inside every woman. Where they make that blood they come out. But that in our science, but we'll still talk small water. So every month, the woman, what we call ovulation. Okay. Every month they release one egg in anticipation, say get forget belly. So if you get sex as a woman where you don't begin mess, I make woman they can get say I don't see me period. That means say that cycle, that menstrual cycle they stop. You stop the blood because the thing the egg way for common because sperm not go for go germinate. You understand? That cycle they don't stop. Immediately a sperm cell go for go germinate, that egg we can see as blood. The cycle they stop. Because there's pregnancy, there's the egg now they fertilize or become a fetus and the baby and all. So, but if that did not occur
Mm.
at all, then that egg day, where the woman they pull every month, it they broke, then the blood now they see as menstruation because the woman no gets belly at that particular point in time.
Okay.
Right? Yes. So
Okay.
menstruation is simply that process the way blood they come out and show say woman no mature.
Okay, so of course we get first timers out there with the listen. We get the one that we don't go through then already, don't they see they don't kind of used to, and we get the one that now they left that cycle. Yes. So we want for dive into first timers, especially the one that we can see them period newly, like the one that we can just the effect, the because like most time them picking and can hardly this not topic they're not okay, so put much emphasis and focus on in schools them. I don't know for now but back in the day they put much emphasis into this topic. Yeah, so for first timers them out there, especially where they listen this program, waiting at the basics where they need for know about menstruation, like menstrual hygiene per se, especially if they need to go through that thorough teaching for menstruation.
Well, so first of all, as a young girl, I believe say it's on the parents, right, for lady them begin coach their girl picking them for waiting they go for expect. Say at a point in time or immediately they begin notice, especially when Bobby begin come out because for a process, for them begin mature, it goes through a lot of processes. So first of all, waiting they begin see Ali at the Bobby. They begin come out, that if you begin shows and begin go through. Usually after when the Bobby they come in, it take 1 or 2 years before they begin mess. So through that period in the even at the mama, I can always see that thing in the before make you pick your best yet. Because immediately when you begin seeing period, like psychologically everything about her they change. Now they become more conscious of himself and the environment. And you as the mama, you for being best by the way for able to tell you everything when they go on with them physically, emotionally, you understand. So that is one aspect of her. Then the other thing again, like when picking and not begin see them period, first of all the age gap between or the age range for puberty, the normal, because you can get rare cases where not always can always happen say from 9 to 15 years, in between 9 to 15 years picking for don't see period. So below 9 they get 1 or 2 people picking them we can see them period like 8, 7, very very rare. And that can be as a result of genetic causes, something in the family can just happen. After 15, that is late puberty, right? And then the back can happen sometimes picking them we can be obese, the one that we can get body. Usually they can prone to late puberty, and even the one the way they exercise or they train, you understand, they can go back to late puberty. But apart from that, the other reason they can be back where can make beginning against late puberty. So 9 to 15 years, picking or girl picking for don't begin seeing period. That's a normal. But it don't mean say if you see less than 9 or above 15, it's not normal. Like you get 1 or 2 very rare cases. So when picking don't begin seeing period, how for take care of himself? First of all, the first 2 days they are very, very, it can be very heavy. So then first 2 days then they, based on the financial status of the picking, because if I can't talk now, I say if I change part 3 times, one time and napkin they use. Then I sanitary towels they use. You don't know inside the picking. So you therefore make do with what you have, and also you therefore talk for everybody in level. So if you are able to afford the family inside you come out, at least the first 2 days, make sure say you change your pad more than twice a day. So you wash in the morning, you wash in the evening, at least before change the pad. Because that blood when they come out inside, remember, say it's a waste. You understand? And if you don't take care of yourself well, you expose yourself to infection. We're not good at all. And even this at that particular point in time, even the scent or the smell or
it can actually
nice
go
to
out.
actually, be very hygienic. Wash off all this, you understand? So change at least twice a day for the ones that I can afford. If you know say that sanitary napkins you use, you can get more than, like you can buy 3, 4 you can get. So just stay in the habit for make sure you clean them and you iron them. right? You can change them twice a day.
Mm.
So you dey iron the napkins wey you don use them this month, wey you don use them, you dey iron them properly, you dey put them first na lukewarm water, you soak them, you wash them, then after that you iron them and you keep them for the next day, right? And then one day for be very careful, because if you don't launder them well, if you don't take care of them well, it will cause problem back.
Oh.
So now first 2 days, make sure, because these are your heaviest period days, you change at least twice a day. Then the subsequent days, you can change, you know, twice, once, as the case may be, because you don't know the financial status of the pikin. So man, they're not able for buy pad every month.
Yeah.
But for you able buy pad every month, make sure say use them wisely, and use them well. At least at the end of the day, better you use them than you can't get sick.
And then you can begin to spend more
Exactly.
money back. Not
Exactly.
true.
Then you make sure say where you see your period, they can close them back where you dey wear, right? And make sure say the way you place your pad on the pants.
And then there's another thing, because
that's
it can
the problem.
shift.
Yes,
It can
because
shift.
most people they don't know how for put them, right? You know where you dey open pad, like there's this the gum for put on for spread and fine at the pants, then for let the gum at least
The
attach.
butterfly or
Exactly.
something.
So down the back there's a technique, because some man no can sabi, some man can just spread and no more. No, there's a technique. If you know how very well, I wish we get a pad or pants we'll be able for demonstrate. But subsequently we can do that one in other programs.
Hold on, I think I also forgot.
So before we let us say, you were the mess.
I don't know about pants though. So let's try this
Okay,
one.
so no just demonstrate. Thank you very much. So this is the pad. So now you open the pad like this, right? Open it like this. Then there's this gum at the back.
Yeah.
They remove this. They remove this, right? This. This is the front, and the front this knife for the before. Put and so. Then these two, when they can be in, then they lap like this. So the straight like this.
Okay.
That's how you do it. That's how these two. Then they can lap
Together,
like this. Together.
like okay.
Yes. Together like this. You put on some, see how it sound like, see? So when this don't lap so now, and then they come out.
Okay.
But if you put on at the pants, like some man can just put on at the corner of the pants, then they come out and it goes shift. But when you don't lap them two together, like this, they come strong.
Okay, you kind of seal them.
Yes, you seal them. So that's how you do it. So thank you very much.
Okay, at least we got something practical going on.
Yes, I always learn from the practical, because a lot of people they suffer in silence. So after we are talking about menstrual hygiene. So wash, apart from that menstrual hygiene self as a woman, before always in the habit to wash twice a day. Right? Always in the habit. Then also we get someone that can use nylon skin tights, someone that can use nylon panties. So during your menstruation, use cotton pants. Because nylon panties they're very hot. And the environment, the vagina, a place where you get bacteria, and they look for a very favorable environment for let them grow. So, and one of them favorite environments are heat. So if you go wear nylon, somebody sleep on nylon, then the part they where they block breeze let they blow,
and then you go put your skin
then
tight.
you go wear skin tight back. So
and then you wear the skirt or the trousers back.
So you see,
double heat.
so all that they predispose you to infection.
Okay.
Because now the place is moist, because blood they come out, the place is hot. So after you period, so woman they can say after they see you and they discharge, they pull bad odor and then stuff. It's all depends on how you take care of yourself. It is very important. So please don't use cotton panties. You can use the black cotton panties because some man can say I can for use black or whatever. But everywhere they use black, remember I say black, they draw it. Right? So don't they wear too many things, too many tight things.
Package
At least
yourself.
give yourself some breeze, you know? Give yourself some breeze. So take care of yourself well. During your periods, you change twice a day or at least twice a day. And you know, then you when they use sanitary, make sure say you book them well and you preserve them well for the next period.
Okay, so you really talk about infection, if person take. Is it that not the only thing we as a woman you exposed to during that 10 day, like person go exposed to sick because more or less I they believe say you are more open or exposed during that 10 day. So are you liable or vulnerable to sickness and all anything in it during that period?
Well, yeah, well, the only sickness per se which you're liable to as a woman is the vaginal infections. You understand? So anything because remember you put something foreign, right? So you can easily introduce germs, bacteria into the vagina, which will cause an infection. Yeah. So where you see your period, cleanliness down there is very, very important.
Yeah.
How you wash and take care of yourself is very, very important, even before your period. Right? So as a woman, one of the things what you always tell, or I can say, when you go wet as a woman, you always find for dry yourself off. When you don't wet, you can use water, then you get your tissue, when you need to dry yourself off. Because you don't find for the way you have that place in the soup.
Where they damp.
You don't find at all. They put bad odor and they encourage infection. Right? Then when you wipe with the tissue, and from front to back to front, because the back now they the anus still, and you know it's in the anus,
Yes.
So you introduce now the bacteria from the anus to the vagina. If you wipe from the back, they count at all. So you take your time, wipe first the vagina, you wipe them properly, and then you go to the anus. That way, you prevent yourself from this vaginal infection, and also you keep yourself dry. And you yourself as a woman, you be confident because when you are moist down there, you feel uncomfortable. I don't know, for me, they feel very uncomfortable. So when you go ease yourself, make sure say you clean yourself very well. Secondly, when you go sleep, as a woman, if you wear boxers, sometimes you go say, I know I'm really don't know like that. Just empty boxer, no wear nothing on that because it needs. I mean, I can laugh, but this is not true. You need breeze.
You need
air. Because if there's no air, the place where it's hot, you will predispose to infection. So at least wear boxer. You wear your vest, you sleep. Please, it needs air. Okay? Then also people like in the habit for wearing leggings or sometimes skin tight for a very long time. That is not also a good practice. Like I had said, I didn't emphasize air. So if you don't come on, sometimes come on for the day, you don't wear skin tight for a long time.
Don't sweat.
Please, as you can so, as you pull the skin tight, so just wear your boxer. Don't go begin block again. You understand? It's the truth now.
Yeah, because incessant is sweat.
It is sweat and it needs air. Right? Only thing that they will need, these are some two things. One that they even recognize, but another they cause problem.
Yeah.
Right? And also, as women, they don't know they in the habit for they eat too much sugar.
Because usually they can say a man, they don't know.
Yeah, woman. Because one of the things we get also in the vagina, because we get what we call microflora, when are like, bacteria that they don't yonder, when they are good bacteria there. Whether they help for keep the vagina in pH, if the vagina is acidic, right?
Yeah.
So that acidicity of the vagina, they prevent them from certain infection. Because some certain bacteria, they for thrive in that particular environment because of the acidic environment. But there are certain things that what they do where it reduce the acidity of the vagina.
Mm.
Like there's a particular bacteria called lactobacillus.
Mm.
Yes, lactobacilli or lactobacillus, then at the vagina, they help for maintain the pH of the vagina. So if, like for example, douching, the woman they wake say, I want fine scents. They use their scented soaps, they are causing more harm than good. Because they kill the good bacteria, they predispose.
Directly.
Yes. They left now the vagina empty for the bad bacteria they enter. Because if you use them scented soaps, remember they are antibiotics. That means that they kill the bacteria, whether they are good or bad, they kill them. So if the lactobacillus the way they help for keep the environment, for prevent the bad bacteria that go inside, if they kill them, then it's like a scale. If the lactobacillus they maintain, then if they kill them, the scale they go down.
Yes.
So then you predispose yourself to infection. So don't douche. Just use lukewarm water, mild soap for wash day. That's in the game sense, yeah?
And in a wash of
inside. Spray. No. Get your sense as God maker. Yeah?
Well,
Don't begin go douche. It creates more harm. Yeah, you get a lot of ladies every day now.
yes,
When they
actually.
douche. It's called douching. They use scented soaps, they use whatever, just for say, okay, let's get fine scent. That's bad. That's a very bad practice.
Coming to that, actually, since they don't debunk the entire idea of scented soaps and perfumes and all the rest we ladies can use, right? Now, let we come to the natural way, right? I go Google a search for a couple of natural stuff and like that, and there was lime. They show me Irish potato. They show me oh god, what's this other, if not again, it's something you just dip inside water, then when it melts or so you use and wash yourself. So now let's say the artificial way is not correct. Now what about this natural way people that do it self, people that can use lime?
Yeah.
They can use lime, right? And then I seen an Irish potato. I don't know for which reason. And then a couple of others. But is the natural way safer? Like natural means or what's not? Is it safer than using all these soap and sprays and bottles, or not the same effect in go for come with at the end?
Well, to answer that, for like I just tell you what the douching is bad. So for lime, I know about lime. Most people they use upline.
Or upline?
Yeah, and the provinces, what they know, they don't know the mechanism actually. But lime, you don't say lime, they cut off bad scent.
Yes, and basically we know.
So like a lot of them can use lime. So they use lime, they rub over fire. And lime is also acidic, it contains citric acid. Right? So if somebody get infection, when they use lime, they find out, say, oh, it gets better. Although not for all infection. Not for all. So what me would advise as a medical doctor is if you have if you get a vaginal infection, you go safe for like an hospital. Because they get a lot of things that when they cause them. Right? In the provinces, what they know how to use is lime. And it works for them. And but say I use lime, the scent cut off. Yes, lime is good because in properties the citric acid, they get also other properties where they kill, like they kill bad odor. It also they help as antibiotic, as a natural antibiotic. So like yes, we can tell us okay because this is what you know, it works. But to be on the safer side, sometimes not to all dandy. There are other reasons why that might be happening to you. So you will find for present and the hospital, be able for do we find it, at least we say, oh, we are very sure that this is the condition, we will give you the correct treatment for that particular one day. So to also the statements, the use of natural ingredients is well and good because what's people that when they applying, if you don't use it's just like you don't use something will work for you. I like how you talked it and
You don't all
I use this, you work for me. It's the mentality, right? So, yes, they work, but I would advise any woman when they go through any problem, it comes to for vaginal infection or whatever, for present at any hospital for any correct treatment. Because sometimes it's more than what you think. What if it's cervical cancer? What if it's an STI? You understand? All those things lime cannot cure. So fine for always telling say fine. Yes, lime can help you, but present at the nearest facility, the health facility, explain, and then get the expertise for no say, okay, let do this, let do this, let do this, probably this, based on the symptoms we they present with.
Yeah. Okay. So in a short while we'll go for we short break, but before we go, make we take this one question quickly. So coming to the area of being on your period, of course, women they will go through a lot when we go through a period differently as individuals. We all get different experiences and move they go through with period. And as like you say, most time the way person use certain something and then see saying work for and just stay go with that no matter what you say, as long as it's in the work for it'll go with that. So when you do on your period, especially you can to mood swings, you can to pain, you can to all these things, like is taking all these drugs, medicine like advisable, or is there a better way or make the person just be at the pain?
Okay, so we get what we call premenstrual syndrome. Usually before there are triggers, usually before woman see period, there are certain things where they notice, like me. There are certain things I notice, oh. And another thing again, before coming to that premenstrual, is knowing your last menstrual period. So it's always nice for letting you know the number of days in between one period to the next. You understand? It's always nice because a lot of women do not know. So how you go do that one day, like when you start for C period, the first day we start for C period, the first day we start for see the blood, then at day one. Day one, then you continue some women they see 5 days.
Yeah.
Usually 3 days max 3 days minimum, 5 days or 7 days maximum. So women they see up to 7 days 1 week they see them period. It's normal. So let's say you begin see period like the 1st of June, right? So until now 5-day menstrual period you get. So day 1 is the 1st, day 2 is the 2nd, day 3 is the 4th, day 4 is the 4th, and day 5 is the 5th. You dey continue for counts, day 6, day 7, day 8, you understand? Say the next last is July, the time we begin see I'm back, then count the number of days in between. Some man are 25, some man are 26 days there in between, and that's your menstrual period. Yes, you understand? That's your menstrual period.
The days in between.
The days in between. So it's usually between 21 to 35 days. If you see below 21, there's a problem. Above 35, there's a problem. Right? So between 21 to 35 days for woman, that's the normal range. Say between that day, if you see the next period. The only one that we can be peculiar, we can not conform to the rule, and the one that we can just start puberty. They can get irregular periods.
Yeah, on and off.
But as a mature woman, especially when you're 20, 21, 22, if you're in between 21 to 35 days, if they're below,
there's a problem.
Above,
there's a problem. Okay.
So now, to answer your question, so now, where you don't know, say, that 25 days, they're in between. So until they're 20, they begin to notice things. They begin to notice breast tenderness. We call it premenstrual syndrome. Mood swings. They begin, some man they bombele, some man are constipation.
That's why I start saying individual experiences. Exactly. You must know your body, understand your body.
Don't necessarily know more anything.
It's
personal. It's mood swing. Some man then after when talking, they cry. They become so emotional. They feel them. These are all the things. It's different from one woman to the next. Some man and they become overexcited. Some man they become depressed. Throughout that period, they sad, they vex, they look himself now. We don't want to see nobody. Then you get somebody who will be so excited.
They're energetic.
Yeah. So it's different. So these are all one in short. Say you're about to see your period. So that is why it is very important to know how many days they're in between your period. Because when they know, when they reach 9, you know. You begin to notice, oh, I'm sure something this time in period I want to see. Then also coupled with the fact that you will get your calendar, your personal calendar where you go to mark. So that is one of the things I'm going to leave with everyone. For later you get your calendar, always know your period. At least, sometimes it will come later. Sometimes it will come earlier, but at least get an idea of when your next period will come. It's very nice. So, in the premenstrual period, syndrome, where they get your period now, some man they get pain, some man they get pain.
Yes.
It's different. Some man they get pain, some man they get pain. So if you they get pain, you they take. Yes, it's advisable to take painkillers because depending on how the pain they present. Some man when they get pain, just hot compress. You could take towel, hot water, then you press it at the back. Somebody go lay down with in belly. It's okay. Somebody go wash with warm water. It's
Definitely.
okay. But some people they get so severe, and if you get to call and dysmenorrhea, that means it's a very painful menstruation. If it's extremely painful, then there's a problem where you need for going to hospital. But if it's not that painful, you can take like get this waiting lady mal or so diclofenac or something. Where you will just take for that time at least for let you cool yourself down. If all the other options they need to work, then you will take a painkiller. But it's not advisable for they will just they take
Thinking
painkiller.
that every
Oh
month,
yeah,
every
every
month.
time, because even the painkillers they get after effects, they get side effects. Right?
And then eventually the body they kind of used to and it get
Yes,
affected.
and one of the side effects of medicines or painkillers, especially diclofenac and all, now peptic ulcer. So if you continue for the take and they develop ulcer, right? That is a mechanism we no go into. But when they take painkiller, you therefore know how you take them, right? So yes.
Okay, the program to get interesting. Don't go anywhere. We want to go for a short break. The program where you they watch currently in the wellness program episode 8, where they come to you live on Redeemer television channel 25, and also live on my Facebook and YouTube page Redeemer Media Television. And if you want for a call or be part of the program, you can call or send your text message to 079 716 255 079 716 255. Don't go anywhere. We'll be right back. Sick pande sef wey dem no know who sign in comot. Na for sake of that make the empower. The first time wey boku gal pikin dem can see blood dey comot na dem woman part, dem can panic or get traumatic experience because the first person wey talk or approach dem not do am proper one. Wey gal pikin don reach certain age, as bookman dem can call am puberty. Na the time in dey begin see im period or a mess. This na something wey normal and na all man, especially you big person, in responsibility for teach and show dem gal pikin dem ya how for take care of themselves during that time day. Master sabi people dem don find out say boku woman dem no can do and take the right thing during dem period, especially dem young gal pikin dem ya. Na im make dem kin tot sick pan sef wey dem no know who sign in comot. Na for sake of that make the Empowered Girls Advocacy begin reach out to schools them in them 28 days awareness outreach, who side them teach and show how people them for approach them young girls them ya and teach them about menstrual hygiene. For crown all this, them be get a one-day workshop who side then come with different school picking them and then teachers them for make the can yeri but menstrual hygiene. The first speaker, when a Reverend Mrs. Walker, be go on for talk but in experience as gal picking, we no be get mama near in talk how it important for maiden picking the yaso, no but menstrual hygiene as na one human rights issue we pokuten them with no look. The cultural taboo, discrimination, and the religious intolerance can cause negative effects not to the girl picking but self in mental health.
As a child, I was that motherless child. Really, I didn't learn about menstrual teachings in school, because in those days, it's a taboo, you hardly talk about it. Teachers will not talk about it. But one thing I want us to know this morning is that menstrual hygiene is a human rights issue. It's your right to know about it. It's your right to exercise it. It's your right to have your period, because it's God-given. Menstrual hygiene makes up our bodily autonomy. Most women, girls that are falling out of school, perhaps one reason was that. But most of the time, we do not look at it. The moment you are a girl child, you are a woman, menstrual cycles define you. It is you. We have one thing we should know as pupils, teachers, guardians, and parents, that there are taboos, cultural discriminations, and negative vibes around menstruation.
In same way, so continue for guidelines on how you as teacher, especially for approach and teach them picking there, but menstrual hygiene. Self, you as the parent, you get for good monitor you gal picking during in pregnancy, so you go know how in blood they flow. If in need for take blood medicine or not, or if in need for contact in doctor.
It's a wonderful thing as a teacher to have that opportunity to talk to your pupils, to talk to the girls, to educate them, to teach them. Number one thing you need to know as girls, parents, teachers, guardians, we should know that menstruation is normal. Menstruation is a normal process that should happen to every girl once she reaches puberty. One thing you should know, because you have menstruated, because you have started your period, you can be a mother at any time.
It continue for sure how girl became for take care of himself during the tender.
Number one, girls must continue to wash normally during menses. Not being clean can leave the girls at risk of infections. Let me tell you the pads you use, whether it's the cloth or the one imported. Whatever it is, you have to make sure that it is clean.
Mrs. Fona, the second speaker, we go through how and waiting key cause for make blood the comot na this woman here so in secret part.
The uterus is the womb. It's one part of the body that enables a woman to give birth to a child. That's the room where the baby sleeps. And what comes out during a menses is about of a lining. They are lining. We have doctors here that can explain better. In the womb, the uterus. When no pregnancy occurs, if you have not having sexual intercourse, mommy and daddy business, it sheds out. And when it sheds out, it comes out in the form of a blood mixed with some clot. That clot, normally in a local I would say clot. It's called mucus. You see little stems in between your periods. Not so. It's because of the shredding from the uterus, the lining inside. And it is normal for us to have it.
Finally, they become with a doctor. We can teach them picking there, but menstrual hygiene and how they for take care of their woman part.
So this is who you are. This now you female, you outer female reproductive organ. They call it the vulva. What do I call? What did I call it? The vulva. So now you have 3 openings. You get the clitoris, and then you have what we call the urethral orifice. Simply put, outside the piece they come out. Then we have the vagina. The vagina is actually outside the blood they come out when they menstruate.
We be talk to the picking them for make them tell we waiting they don't learn. And same way so, how woman for maintain and take care of himself during a menstruation period.
Okay, my name is Salam Alek Shakago, attending the First Academy School of Excellence, where today I don't learn about like what it takes to tell me about menstruation. like we do on the menstruation, if you know when and how to take care of yourself, if you take care of yourself, at the change the party, and also if you interact when you do on menstruation. So we talk to people about menstruation. Like most especially some really to us, like parents, for they with them explain some things. Although some parents they ask, but you forget somebody. One person must be where you like and we go and tell everything.
My name is Adagami. I attend the Fawe Primary School for girls. I did a class 6, which I don't learn from this program. So enter we they go through a menstrual period for know how when and how we they use the pad, we they don't use it for put a safe side we no for suppose no go see or you gonna the one the way they use pieces because not all man go able afford for buy pad. If you not say you wash and fine dryer, you iron and put on a safe side. The alarm say not for washing magenta with soap because it cause bacteria. If you only wash with hot water or lukewarm water.
That break, of course, listen and watch the program, the wellness program, when it comes to you live on Redeemer Television Channel 25 and on we Facebook page and also on we YouTube page. Don't forget, you can be part of the program by way you could send your message or you send your contribution or feedback or ask a question on 079 716 255 079 716 255. And if you get any you can drop your comment below. Just drop below. And don't forget to like, share the video so that you reach far and wide so that most and who Gulf can then go get for know and hear this message here. Okay, so we want to continue with the program. Of course, we got wonderful guest wait on there so we don't learn a lot from her. So we want to continue with the program, and of course we want to go back to the very beginning from question 1. This how we ask them waiting a menstruation, and in the talk say when the woman get the womb, they shed the womb and the blood they come out and all of that. So that brings us to this next question. Well, most time, especially for movies or what's not, most of that statement say you not get womb or you won't get issue or one or two things like that. So why not for person we possibly in the past they don't go through several abortion, don't cause damage to your womb, and one, or don't go through surgical operation for remove in womb. Then people they also still they go through a normal menstrual cycle, or it can just cut off before they reach menopause.
Thank you for that question, Dave. So for the one that we can go through a lot of can get a lot of abortion, obviously as long as they get a womb, they still they menstruate. The only issue can be the issue with like forget speaking for they don't anymore. Because if they get multiple abortions, then for example you do D and C, they get what's in they go, then crepe the womb, go. So it cause problem to the womb. At some point now, beginning they will fall they don't they.
Okay.
So some of them people that they can usually experience multiple miscarriages. Right? So you see they will say, oh, I don't get belly after something 3 months, because the woman got the capacity again for hold the picking.
Okay.
Because of the multiple procedures they will
don't go through.
Yeah. So then they still menstruate.
Normal.
Still, yes.
Like how normal they do before.
Yeah, and they still get it wrong.
Okay.
So the only time where, like, I think myomectomy now, myomectomy is simply a both for fibroid.
Okay.
Right? So if they pull your womb, like what we call hysterectomy. Hysterectomy is surgical removal of the uterus or the womb.
Okay.
If they pull that one day, the hormones and whatever they greatly reduce. So as a woman, you not go see period.
Okay.
You understand? You don't go see period. Because the womb, you get the womb, then you get the ovaries, then you get the fallopian tube. So if you watch the diagram of the internal reproductive system, you will see where the ovaries and the dome, then you get the fallopian tube, then you get the womb inside the bikini dome.
Yeah.
So if they surgically remove that womb then you don't go get, because it's a process.
Yes.
So the hormones that they work on the ovaries, then they release the egg, then they go and if the sperm fertilize the egg, then the womb or the uterus, they don't even know. Or if sperm not fertilized, then through that uterus, the lining of the uterus, then they shed as menses. So if they don't remove the whole thing, they need a mess. Right? The thing where when they do fibroid, if they pull, if they pull out growth, my belly and all, that need to stop you. That need to stop you.
You still the mess normal.
Yes.
Okay, so what of women then, like basically, of course, people then get their own different experiences when it comes to menstruation, but what of the one then now, they are not beginners, don't tell with them, they are grown women, and then they're not see them period frequently, not that they are approaching menopause, but then not they see them period frequently. Is it that there's a problem? And the other times you can hear people say I miss 2 times inside the month. I'm sorry if I can bring this up. I really think so, like we person miss 2 times inside the period, that there's a high tendency saying at 20 for people. Yes, that's how we feel. That's how kids take out. They get high tendency in a twin, so the first egg na come out, so the second egg na come out.
Anyway, so that can happen if you get shorter menstrual periods. Like for example, if you get a 21-day cycle, you miss twice in the month, because with almost days inside 1 month.
30 days, so
31. So if you don't take the first 21, the next one they can inside the same one.
Okay.
You understand?
Yes.
So if you have a shorter cycle, you miss twice, and that's not a problem.
Okay, not anything good, but that's how we feel. So, and then this whole when so you come back, say the first time sometimes you miss light, and then that's second time now with the menstrual period, then it can be heavy in back.
Well, you mean like the first?
Yes, like inside the same month.
Inside the same month, you say the first time we see period and lighter, it's light.
Yes.
The second time it's heavy. Well, period can be very dynamic, I can tell you.
Okay.
The only time when there's a problem is if during your period you notice say there's a heavy menstrual bleeding. What I mean heavy? Like you change like 5 parts a day, like they soak the soil is change like that means there's a problem. You understand? Because if like for 1, 2, 3 days you notice heavy bleeding, that means there's a problem, right? But as long as it's a normal,
just normal, like how it can usually be.
It can be very dynamic. Sometimes it comes heavy, sometimes light. The only time we get problem when you notice, say no, this is not normal for me, and it's like I'm bleeding. So you change a lot of parts in one day, which is very suspicious. So you go to hospital immediately. That's the only time you raise concern. But for the way you mess, when you the teenager, not the same way. It changes sometimes. Your cycle changes.
No, speaking of changes, that brings me back to my first statement. Like, person where you're not pregnant, you're not approaching menopause, none of that. But then you get you're not a beginner either, but you get irregular. With if you miss this month, you miss 2 months, you miss this month, you miss 2 months. Is that the person okay? I need to see a doctor.
Well, a lot of reasons they can cause that, because you therefore take into consideration, is this woman on contraceptive pills? Okay. You understand? Or if she's not, what is happening? There what we call abnormal uterine bleeding, where a lot of things can cause them. One of the things that they call contraception, so pills that when they take, they cause intermenstrual bleeding, it will cause abnormalities in your period, in your cycle. So all that things that they get for rule out. If they are ruled out, you see, say there's no problem in that area, then of course we will go in, we get all that tests that we will do. Say, okay, well, we don't know what's exactly a problem, because sometimes it will come from the head. Because
the mind thinking.
Yes, because the meaning what I mean the head, because we get in the what's in the brain, we get what we call the hypothalamus, that's science, right? So then they regulate your menstrual cycle.
No.
Yes, everything is here. So there's a signal from the brain. go direct to the ovaries, then the uterus, and then
For me, it go normal.
exactly. So you check from all the levels. Is there a problem with the start, say the signal they come out, or not from the ovaries, or not the you understand?
Yes,
so
I understand.
also they check all the things. So if you get abnormal bleeding, just conclude say, oh, this thing you get for rule out everything before you know the cause. As a result of contraception or woman they say family planning, we get for address that one. We get for say, okay, well this that. So I make way if woman they go for family planning, we get for tell them the advantages and disadvantages of each and every one of them. They hold on you, then you get the leeway for choose. Say, okay, based on Brittany, yes, a woman they wait to marry, they want for space them picking them.
Yeah.
Right? So because calendar method is not working, it's not effective. So someone they can say, okay, well, this is the number of children I want to have with my husband. In order for you get that kind of spacing, someone they can go. It's okay, well, I will take family planning method. That decide on how I will space me picking them. When you go to hospital, they say, do this. Now you know, so it will work. Any advantages, na so, disadvantages, na so. And you all the options, and then you choose. That's how it's done. Yes.
Okay, so we're almost on the come to the end of the program. So based on the previous video, we'll go for a break. You were doing a teaching about let's say the part of the vagina. Should I call it that?
Yes.
Call it that.
Yeah, so parts of the vagina. So you get the external parts and you get the internal. Right?
Okay.
So external is what we see out there. So, well, I'm not going to call them parts of the vagina per se. I will just call everything you see externally as a woman is called the vulva.
The vulva.
Yes. The vagina is part of the vulva. So everything you see externally is the vulva. So you have three holes down there. One is the urethra. The urethra are actually outside the urine they come out. So some people like if it's at the same side outside the urine they come out and then the baby they pass. It's not the same.
Maybe they feel so.
No, it's not the same place. So the urine they pass now totally different parts.
In a down the bed in the
Yes, that's the reason for.
Nothing more, nothing less.
Yes. Then you get the vagina. Outside the baby they pass, outside the menstruation, the blood they pass. You understand that? Even sex. That's through the vagina.
Okay.
Right? So then you get the anus. The anus now we all know say of course.
It's standalone.
All man know say that's the hole. So now three holes they down there. The urethra for urine, the vagina for babies to pass, for menstruation and also for sex. And then the anus for defecation or way to pass through. So now the three one and the vulva, the anus not a part of the vulva. The vulva is just some of the external reproductive organ of the woman, like the vulva, what did they see outside?
Okay.
Then inside, now they get now the uterus, the ovaries, and the fallopian tubes and all that. And inside you get them. You understand that?
Yes, we don't get that part. Very clear. So for them out there, we don't listen to you concerning menstruation and all it's a lot, but thank God. So waiting at the word we go and left give them out there.
Well, last words, what me go say, parents, please, puberty, now a very delicate stage for any girl picking. Now a stage where in as I say earlier, where you for call you picking and make her your best party. Because when hormones they don't begin kind side, now then now you feel you need that extra, extra assurance, you need that extra love, it's very difficult to be an adolescent. It's difficult. Because now your hormones are just battling here and there, you become more sensitive and all. Where you not be small picking, like the things that way you go take lightly, where you actually they're very cautious. You understand? A very small thing where they will tell you take them big, and that's the day you go feel say, Sami pass everybody, or nobody not for tell me nothing. Yes, That's part of adolescence. So if parents, I'm talking to you out there, please, we begin the way they go through puberty, where they begin to see them period. Yeah. No, Lord, they encourage them, Lord, they talk to them, Lord, they know. They don't get the confidence for speak out. They don't be so confident for telling mama, say, oh, this boy and me, or they go through this. They not be so hard or strict on them. They don't go find solace out there.
Yeah.
They don't go find some kind of paddy, teenager or bobo, we will give them that kind of like confidence or assurance, which is a big problem. The assurance should come from the home, from your mother, from your father. Then they're able to go you can hear. Then secondly, the last menstrual period, as I will say, it's very, very important for every woman get a calendar. Know the time where you see where you supposed to see your next period. So woman there where they can get belly, because me at the hospital where they cannot get belly, where they go say last see normal, they don't sabi. And from that last normal menstrual period, if you not do scan by adventure, they will for date the pregnancy and know who stay will born, likely born the picking. Now one of the importance in that one day. But generally it's good to know your last menstrual period. You know for tracking there is a problem. Say, I notice a difference, I notice this, I notice that. If you know. So please, when they track and down. If you mess this month, you start from the first, you begin, first, second, third, last in 5 days. After the 5 days, you count. Say the next thing, you know, July back. When you begin notice, say, oh, there's a succession. Say, okay, when 25 days, they're in between all the periods. So when you see the day 25, they even prevent you from embarrassment.
Yeah.
Before the period, you don't put partner in your bag in anticipation. Say, okay, these are the expected. Any kind of way, if you know happen today, will happen tomorrow. Pad always been in your bag. Right? So please, and they beg, mama them, papa them, not to mama them no more. The papa them, no, they encourage you guys to them. No, they tell them about boys, tell them about puberty, right? Tell them what they need to know. So then in my last words, thank you for hosting me today for the program.
Thank you so much for coming. Well, Fambu them, of course, you said stuff down here, especially for parents them out there. This is another way for make you go to monitor you picking. You make sure say you yourself, especially for beginners them out there, you will track the period with the picking, because I don't know why sometimes parents them, like some parents and kids so embarrassed for talk about these things without picking that past the picking go lana or yeah other side. And then sometimes if you can teach yourself. But as parents, I'm not shame how picking them for teach them about them body, what they're supposed to expect, what they're supposed for see. Peradventure, maybe they don't go get them outside, and then it can be a whole lot of problem, because then when you go get outside, then go get their own solution. Understand? So thank you so much for joining us today for this program, and I believe so you don't learn a lot. So the program, Navi Wellness Program, will come to you live on Redeemer Television Channel 25, and of course we Facebook and we YouTube page. Don't forget for like, share, comment, drop your comment below, feedback, questions, or whatever you might have, drop them down below and we will reach out to you. So we want to tell Boku thank to we camera operator Hannah Thomas, VCR operator Paul Flomo, we producer Daniel Morovia, technical team Joseph John Ture and team, and of course we wonderful floor manager Jesse Indogu, the manager for the radio station Daniel Misali, and of course we wonderful beautiful guest Dr. Davida Sesay. Thank you so much for joining us, and of course you beautiful listeners and viewers out there, thank you so much for being part of the program today, and all who that join on for make this program here so reach you like how it reach you. So till next Thursday for another exciting episode with me, Shirley Williams. See you later. Tata.